Hello to everyone and welcome to this presentation about anonymous heartbeats. Let's find out together what this is. So anonymous heartbeats is a humanitarian mission that brings life-saving and pediatric cardiac care to vulnerable children in northern of Iraq. This mission was born around 2012, 13, when we start, myself and two more people, we were working with people who are displaced from the south of Iraq to the north of Iraq, and also refugees. As you know, this area has a current conflicts, and they have many people who is displaced, and because of the current conflicts, the economy is quite very bad. So the system, like education system and health system, they are not really good for the needs of the people. Therefore, we have an urgent humanitarian need to give children suffering from heart disease a real chance to live, but not also the chance to live, but also to live with quality life. So one of the things that we do is to bring people our mission is to support children, across North Iraq who are living with cardiac conditions, identifying those with the greatest chance of survival. I will show you a video where we just transfer a baby who has a heart problems from the north to Iraq to the border to Iran to be helped with a surgery. So this is our ambulance. This is the mother. This is the beautiful baby, and thank God he arrived fine to the place, and he nowadays is around 8 years old. But also we do have cases that cannot be support or help in the country. So what we do is just we have partnership with other hospitals around the world. And in this case, we bring children to their place to have surgery, open heart surgery, because there is no available on the country. So this picture is from, this picture is from going to Israel to bring this baby and this child to be seen for a doctor. This is a baby from Syria who we brought them to the Qatar, and this is in a hospital in Israel. So this is what we do. But also we have cases where the children cannot be helped. So what we do is we just support them. We provide companionship, and we try to help the children, the family to deal with the loss, but also to the child to have at least dignified ending on their lives. So what happened is more than 1,000 children and families are affected by this condition in Iraq. So Iraq continues to face major development challenge due to years of armed conflicts and instability. This is still until today. So as a result of all of this, the healthcare system faces serious limitations, especially in education and medical resource and financial capacity. This place, you have an ethnic group, one is Arabs and Kurds, and both families are impacted in a negative way for the health crisis. So what is the factors to contribute to this situation and problem? So what happened is, if you see this consanguinity within some communities, this means people, it's a cultural thing, where they get married really close relatives, and this develop really bad conditions, sanguineous conditions, therefore sometimes abnormality on the babies. So long-term consequences of chemical warfare and conflicts. 1988, it was a genocide, chemical genocide, and it still have a negative impact on babies when they are born with malformation, right? And then limiting prenatal care and delay diagnosis, that's other than situation. So malnutrition because of the economical situation, and pregnancies at very young age, sometimes even 12 or 13 years old. What happened in culture-wise, they can get married since they are 12. So sometimes the body of the girl is not ready for it, so then the children will have problems. The situation that we have is many families, they have lost more than one child. And grief is something that is not really teach or is in the culture. So they develop psychological problems. So we try to help people who the children will be born with congenital heart diseases to help them at least to keep one child. You know? Families also often sorry live in difficult conditions, so poverty, and they live in villages far away from the city, so therefore there is no easy for them to reach a really good medical care, right? Then we have this lack of specialization nowadays is developed better than before, but it's still way to go. Where that's why babies have to be sent into other country to get the care that they need. Right. I want to show you this testimony. This is a baby who was born with a unique single ventricle. Is called. It's rare condition around the world, but in Iraq is quite, I might say, I will dare to say common. So this baby was born, she didn't get surgery. She is a refugee from village who were involved in the genocide in 2014. So then she got surgery in Italy, then she was growing. She has been challenged many things because this is a condition that is really hard to help. But you can see this child now is about to be 5 years old, but she's now waiting for a heart sorry, transplant. So I met her when she was 1 year, year and a half, and then she got surgery. We bring it to Italy. Then finally she got better. We go back and forward to Iraq and then Italy, and then nowadays she's just waiting for her heart, right? So what we do as an organization is we appeal to the hearts of those who is willing to contribute even in a small grain of sand to help to save lives. This means could be for going like this lady who is a nurse, teaching medical staff, engineers, whatever will help for us to develop a good quality of care at the hospital. We are happy to receive them. We also believe in training people, so the mission can go beyond one moment. So this is really our strong goal. So we bring doctors, nurses, engineers, like biomedical engineers to help us to achieve this goal, right? Is I might say it's like you give some of your life to this project. I mean, we cannot pay you, of course, but just to see these children live, and then you will leave something to the world that will be an amazing things to do. So we seek to unite those willing to give part of their lives and service to others. I just a short history about this. This is a baby from south of Iraq that I was personally asked to do it. I was blessed to do it, to bring her to Israel, where this nurse, she's from Germany, and she give once a year, she give 1 month to this mission to help these children. So that's why we try unify any people who wants to just jump into the ship and help us. We are so more grateful for that. So we do believe that through perseverance, consistent faith, and collective action, the impossible can become possible. And the baby that I just showed you has been an example for that. So this is an organization that we have Christian principles. So we say that faith is the assurance of things hoping for, the condition of things not seen. This is one of our stance that we are for, right? So, well, this is the point that I want to just share about what you can do. At some point in our life, each one of us can consider how we can may leave an impact in this world. Could be, obviously, in this case, I'm talking about anonymous heartbeats, but could be other organization. The point is we should do something to impact our world that we are living in. And so you can do through prayers, accompaniment, medical skill, financial support, or even by sharing this project with others, right? So we're always willing to help, to receive help and also to help as far we can do it. So perhaps in your community, there is an anonymous heartbeats waiting for help somebody. Please keep going. So thank you so much for your willing of listening about this. And when we end the presentation, I'm more than happy to answer any question that you may have or not. or curiosity. And I have many testimonies that I can tell you, the babies who still alive, but also the babies that at least they have a dignity in them, but also the family have a companionship for the loss that they have. So, well, we say thank you very much and gracias en español. And also I will say shukran, that is Arabic, and espadas, that is Kurdish. Thank you very much and have a nice day.